Hello there, my name is James. I'm an Associate Veterinarian here at the Box Hill Vet Hospital in Melbourne, Victoria, Australia.
And I'm Anne and I'm a veterinary nurse here at the clinic. And this is Buffy, our demonstration dog today, and we're going to be running through a few dog handling techniques and how to make it a little bit more comfortable for the animals while they're in the veterinary clinic. Okay, so now we're going to demonstrate how we would handle an aggressive dog. Buffy obviously isn't aggressive, but we're going to use some equipment to show you how we deal with an aggressive dog. So we have some welding gloves here. Now they're quite thick leather, so the dog can still squeeze with his teeth if he bites you, but shouldn't penetrate it as long as they're in good condition. So you always need to check for any holes. And also, of course, a muzzle. Make sure it's the right size muzzle for the dog. And a towel is also handy. Sometimes you need a towel or a large blanket to place over the animal to protect yourself and also the person that's helping you. So now we're going to demonstrate how to restrain a dog safely in the veterinary clinic. You always need someone else to help you to keep you safe and also to try and reduce the stress on the animal. So James is going to pop a lead over Buffy's head and hold her head out the way as much as possible. I'm going to place the welding gloves on to protect my hands and the majority of my arm, and then place a towel over her. You can use the towel around her face as well if you need to keep her head steady. And then the other person's going to place the muzzle gently on her face, on her muzzle.
We're now going to perform a general clinical exam on Buffy. Buffy, like most of our patients, is very tolerant and very good for handling, so we're not going to use a muzzle at this stage. Things you'll usually need: 1, stethoscope, 2, thermometer. And we're going to start at Buffy and work our way back. Okay, generally we examine the dog from the front to the back, from nose to tail. So we're going to start off checking Buffy's eyes, nose, checking her teeth and gums. As you can see, she's very good for us doing this. We'll have a look in her ears, make sure we haven't any signs of infection. Hey Buff. And then I'm going to turn Buff to have a chat to Anne. I'm going to have a listen to her chest.
So you need to always make sure that the animal's restrained. Someone's got hold of the animal whilst it's on the table, otherwise they may fall off and injure themselves.
So I've had a listen to Buff's heart and lungs. Everything good so far. Have a feel of her tummy, feeling her organs in her belly, feel her pulses in her back legs. And we'll also check all of her lymph nodes that we can feel on the outside. Then if we've got any worries, we can have a feel of her legs, of her limbs, of her joints, of her paws, check under her tail, and the ever favourite thermometer, which we won't put Buffy through today. So we're going to clip the hair, and we're going to occlude the jugular vein in the jugular groove, swab with an antiseptic swab, and insert the needle into the jugular vein. As an alternative to the jugular vein, we can use the cephalic vein in the front leg. So Anne, once again, will restrain the dog, restraining the head away from the clinician and holding up the leg to assist me. We'll then clip the limb in the appropriate area, and we'll then raise the vein by occluding it with her thumb. We'll swab the leg once again with an antiseptic swab, and then insert the needle in the vein for collection.
So when lifting a dog from the floor onto the table, make sure that you restrain the head as well as underneath the body. Just in case the dog gets worried and tries to bite you, And also make sure you bend your knees to help save your back. 1, 2, 3, lift.
Good girl.
Okay, so we're going to lift a litre again.
Thank you. Good girl. You good?
1, 2, 3, lift.
Good girl.